Hi students, this is Dr. Ramkumar, Assistant Professor from Department of Psychiatry from Lakshmi Medical College. Today we are going to discuss about altruism, a professional virtue of a physician. What is altruism? This is the definition. Altruism is a principle and moral practice of concern for happiness of other human beings or other animals, resulting in a quality of life, both material and spiritual. So, the definition comes from, for animals and human beings, it is the happiness as a result of, in the form of material and as also spiritual. So it is traditional virtue in many cultures and a core aspect of various religious and secular world views. However, the objects of concern vary among cultures and religions. In an extreme case, altruism may become a synonym of selflessness, which is opposite of selfishness. So, see, the studies show that altruistic behavior is not common in all persons. There can be variations based on the cultures, religions they follow. So, in North, we can see most of them join in the army, especially in defense field, because they want to serve the nation. So it is one of the altruistic attitude seen in those peoples. In an extreme case, altruism may become a synonym of selflessness, which is opposed to selfishness. Altruism is nothing but they don't live for themselves. That is, they don't have selfishness. They live for others. That is the core theme of altruistic attitude. So how does this word come into use? Or who coined this word? So altruism, this concept was being worked on by Auguste Comte, who is a French philosopher. It is called as altruism, which means antonym of egoism. Egoism means for me, for my society, like that. Whereas altruism is for others, for other people, for other concerns, for other community. I'm working for others. So he derived it from the Italian word altri, which in turn was derived from Latin word alteri, meaning other people or somebody else. It means the attitude of the people will be concerned about the others, somebody else, and not for them. Altruism in biological observations in field populations of the day organisms is an individual performing an action which is at a cost to themselves. Example, pleasure and quality of life, time, probability of survival or reproduction, but benefits either directly or indirectly another individual without the expectation of reciprocity or compensation for that action. So what is the meaning of this? So the pleasure and quality of life or time, probability of survival or reproduction, in altruism, it can be either benefited directly or indirectly without any expectation of reciprocity. They don't expect anything from the persons who they help. That is reciprocal. See, you do this for me, I will do this for you. I will give 10,000 rupees. When I need you, you have to give 1 lakh rupees. Not like that. If you give money, if you love me, if you hate me, I least bother. I just want to help you. That's all. That is altruistic. So Steinberg suggests a definition for altruism in the clinical setting, that is intentional and voluntary actions that aim to enhance the welfare of another person in the absence of any quid pro quo external rewards. That means without expecting any rewards, money or things whatever, without any rewards. They want to help. They want to help for the welfare of the other peoples or persons. So altruism can be distinguished from feelings of loyalty or concern for the common good. The latter are preceded by social relationships, while altruism does not consider relationships. So altruism nothing but being very loyal to somebody, being very loyal to some society, or concerning about the social problems. What is the difference between these and altruism? For these, you have some form of relationship with the society or family or something. Whereas these people, they least bother about this relationship. They just want to help us. By helping them, they won't want to develop any relationship. Much debate exists as to whether true altruism is possible in human psychology. The theory of psychological egoism suggests that no act of sharing, helping, or sacrificing can be described as truly altruistic, as the actor may receive an intrinsic reward in the form of personal gratification. So, as we know, for every concept, there will be second thought. Like that, the psychologist started arguing, or they made a debate. Is there really altruistic behavior in a human? That means without expecting any benefits, whether they can develop such attitude. So they describe that helping or sacrificing can be described as truly altruistic, as the actor may receive intrinsic reward in the form of personal gratification. They are saying that they are getting some benefits. That means they are having personal gratification. So that only they are having such altruistic attitude. The validity of this argument depends on whether the intrinsic reward qualifies as benefits. You may think that it is a benefit, intrinsic benefit, but whether they acknowledge that benefit or not, that is the question. So the term altruism may also refer to an ethical doctrine that claims individuals are morally obliged to benefit others. Used in this sense, it is usually contrasted with egoism, which claims individuals are morally obliged to serve themselves first. So what they say is that normally, for a normal human psychology, if I have money, food, whatever I have, first it's for me, then for my family, then for my relatives, then only to the unknown persons. Whatever moral they follow, they have this common psychology. But when you see in these altruistic persons, they don't follow this psychology. Even if they are unknown, even if I'm hungry, I will give my food to the other unknown person who is hungry. So this is the main difference between the normal human psychology and the altruistic psychology. You know about Darwin. He only developed the evolutionary concept. Darwin recognized altruism as a particular difficulty for his evolutionary concept, which was based on competition and the struggle for existence. The widely accepted solution to this problem is model of kin selection, in which cooperation is more likely to develop among genetically related individuals, and which now forms part of selfish gene view of natural selection. That means Darwin, when developing his evolutionary concept, he felt very difficult, though he identified this altruistic behavior in the animals. He felt very difficult to segregate this behavior, because for all the animals to survive, they have to face the competitor to achieve their existence. But when he saw slowly one animal which is genetically related started cooperating with the other, so based on this, they developed altruism. That means If one animal has food, it is sharing with another animal. If that animal gets food, it is sharing with this animal. So he found this cooperative behavior that could be altruistic in nature. This cooperative behavior, however, is likely to be sustained only when there is either direct or indirect reciprocity, in which benevolence to one individual increases the chance of receiving help directly in return or indirectly from others. So, according to Darwin, this altruism is nothing but there is a cooperative behavior among one animal and another animal, and there is a reciprocation. You help me, I am going to help you, which is contradicting the before definition. These are the views of the persons, that's all. So, here, what he says is that if there is chance of getting help from one individual, obviously he reciprocates whenever he gets chance to help that person. So, the experiments involving game theory and computer simulations of these behaviors within populations have confirmed the importance of reciprocity in sustaining altruism. But because reproductive success is often used as an outcome measure, these results should be applied with caution to medical populations. So when he did this game theory and computer simulations of these behaviors, and the studies found that this importance of reciprocity in sustaining the altruism. So that altruism behavior sustained whenever there is reciprocity. But they cannot confirm it in the medical population. Now coming to topic proper, what is altruism in medical profession? See, effective altruism is the use of evidence and reason to determine the most effective ways to benefit others. That is effective altruism. See, if I am a doctor with my degree, for unknown persons, what help can I do? That is altruism. Not for my own, not for my family, not for my own need. So altruism, the performance of cooperative, unselfish acts beneficial to others, has been studied in several medical contexts, such as donating of organs and genetic materials, and patients' participation in potentially hazardous experiments and trials in the pharmacological trials. So by this, they are contributing to the community and society. Those people, they don't know who he is, but the unknown, he is helping the community. So this is an altruistic attitude. While it is often perceived as a selfless virtue, there is some evidence that altruism is not simply an advanced morality that suppresses basic ego-driven urges, but rather is hardwired in our brains connected to pleasurable activities. See, though it is a selfless virtue, some evidence of altruism was found. What we think that altruistic, they suppress their basic ego-driven urges. I want money. If I ask to somebody, they will give. But I am suppressing my ego-driven urge. No, you should not ask for your own need. If it is for somebody else, you can ask. So, the altruistic person, they suppress their ego-driven urges. But the studies has found is not only they are not only suppressing their ego-driven urges. It has been genetically hardwired in their brains and connected to pleasurable activities. By doing so, they really get some pleasure by their altruistic behavior. So the message is that it is not present in all. It is solely it is found in specific communities, cultures, religions, etc. because of their evolutionary development. the genes get accustomed to such behaviors. Altruism has ever been described in some animals, so generally as a reciprocal altruism, that is helping others with the expectation that they will in turn help you. This is called as reciprocal altruism. That means if I help you, you will help me. They have found this in vampire bats. They will share their blood meal with another bat, even though they risk death if they go without a meal for a few days. And primate grooming behavior is another and less gruesome example for this. That means though it is an altruistic behavior, it is reciprocal. Reciprocal means now I am having food, I am helping you. When I don't have food and you have food, you are helping me. This concept is called reciprocal altruism. So physicians' altruism towards their patient and others has been less well studied and is implicit rather than explicit in statements about medical professional values and attitudes. So when coming to this medical context, when altruistic behavior of the doctors is being studied, the studies are very, very, very low. If you make extensive research, you can find least amount of articles on this altruistic behavior in a medical profession. Altruistic behavior by physicians might include continuing to work even after their time, providing informal medical advice outside contracted hours, giving free treatment to poor patients in fee-for-free healthcare system, general willingness to go extra mile in professional activities. There are a lot of doctors who inculcate this altruistic behavior in them. They just don't want to run back of the money. They help the unknown persons, the needy persons, the unreached poor. They want to help them. So now almost, though it is declining, though this altruistic behavior is declining, or the factor is multifactorial. It is not only the doctors are responsible for the declining of this behavior. The media, the public, everything. Still now there are about 30 to 40% doctors who sustain this altruism in their profession. There is much evidence that many doctors work beyond their contracted hours, but there is also a growing feeling that altruism in medicine is not dying, is at least declining. So it is not dying, it is declining. That means the practice of this altruism is coming down. This might be expressed, for example, in an anesthetist unwillingness to accept a final case on the list because the operation would run beyond the limit of the contracted session. I have contracted only up to 4 o'clock. If I take this case, it will go for 6 o'clock. I will not do that. I'm having some other appointments. And there is a general decline in the home visit by the general practitioner. Before, there used to be a lot of home visits. They used to have family doctors. Now that rapport has been come down. And in the recent explicit choices now made by young doctors in balancing professional and domestic commitments. So these are all some of the reasons or examples that there is a declining in the altruism. It is possible to think of a number of ways in which reciprocity might sustain medical altruism. So if we, before as I said, reciprocal altruism, if I do this, do that. The first of these is to support and assist rendered to doctors, assistance rendered to doctors working under difficult circumstances. So during this Corona period, we have seen the lot of altruistic qualities of lot of doctors. They have sacrificed their life to save the millions and millions of patients. They least bother about their family. They least bother about themselves. They want to save the suffering patients. So when such difficult situation comes only, the true altruistic behavior of the doctors will come into light. Doctors have enjoyed for many years a level of social esteem accorded to few other professions. Doctors have traditionally enjoyed material and financial security, which perhaps now is beginning to compare unfavorably with that in the other career opportunities. At a time of unprecedented mistrust between medical profession, the public, and the media, understanding the roots of altruistic behavior in medicine is critical. Because now a lot of graduates are passing, the quality of medical education is declining. They have poor therapeutic knowledge. So here and there mistakes are happening, and the patients are also not in a position to tolerate these mistakes. Patients attenders, they start agitating, and media is boosting. There is a single incident, they start boosting as if all the doctors are doing the same. So there is a miscommunication and collapse of the system, which made the doctors, which made the altruistic behavior in the doctors to decline. The unquestioning status traditionally accorded to the healers in the times of etiological ignorance, therapeutic importance, has given way to more skeptical and disparaging views of doctors now in profession of unparalleled therapeutic capabilities. Pathetic gratitude for ineffective medical intervention has been replaced by escalating demands and expectations, often fueled by media hyperbole and enduring public appetite for miracles. See, now the public has started to think that doctors are magicians. Whatever end stage you bring the patient, you have to cure. How is it possible humanly? If you bring at a very early stage, it is very easy. But they bring at the very late stage with a lot of complications. And they expect the doctors to treat. And if the patient is dying, immediately the doctor has not treated properly, doctor has given wrong treatment. And this media is also boosting these issues. Before also, there was lots of deaths because of complications, end-stage diseases. But now the tolerability has come down. This made the altruistic behavior in the doctors to come down. So, if you try to make all this communication gap, ignorance, proper medical education, all this, you put it in the right place, obviously the altruistic behavior of these doctors will come down. I mean, will grow up. The critical role of open and honest dialogue between doctors and patients have been emphasized. But this can be difficult to achieve as medicine becomes more complex, fragmented, episodic, and impersonal. It may well be that the conditions that encourage clinicians to join and stay in their post are not dissimilar to those that are needed for the development of altruistic behaviors. If it is also true that the maintenance of these behaviors depends on the recognition of the individual's similar characteristics, clinical and professional values, and on the expectation of reciprocity, then there is a short message here for managers and policymakers. That means the government has also a role to improve altruistic behaviors in the medical profession. disenfranchisement and disengagement of dimensions of demoralisation and burnout, a constant threat to the physician's health. Workforce planning needs to be more than a number game and must pay explicit attention to working conditions, incentives, and rewards provided for all healthcare workers. See, there is a lot of patients and only a single doctor is attending. Think of his position. So, government should take necessary steps. Where there is patient is low, you can put single doctors. The patient load is very high. Obviously, you have to appoint extra. And you have to give incentives, provide rewards for their uh, acknowledge their work, especially in this COVID, when acknowledges COVID barriers. That gives boost up to the doctors. That develops the altruistic behaviors in the doctors, and they become the role model for the future generation doctors. A study examined whether appeals to altruism would reduce patient requests for overused medical services identified in Choosing Wisely campaign. Choosing Wisely aims to improve healthcare quality and control costs by limiting the use of common but overused medical tests and treatments. So, in a study, Ricks et al. Presented study participants with 3 hypothetical vignettes. One is antibiotic for acute sinusitis, imaging for acute low back pain, and an annual physical examination of a healthy patient. And asked them to imagine that they were seeing a physician for common health problem. So in the control vicinity, the physician's rationale for recommending against the service was framed, providing minimal benefit and potential for harm. That is, he gives for sinusitis no need of antibiotics, but he gives antibiotics to be on the safer side. So that causes unnecessary stomach problems, resistance, etc. Whereas if the same doctor looks in the altruistic version, then he won't prescribe antibiotics, because foregoing antibiotics would provide a potential benefit to others. That means unnecessary antibiotics not given to somebody, that prevents antibiotic resistance in the community. So he don't want to give. If unless otherwise it is necessary and is certain and the symptoms are very severe, then only how to prescribe. Otherwise it is not necessary. So this is also an altruistic version of the medical profession. The authors also examined the effect of altruistic appeals on physicians' rating by participants. The hypothetical appeals to altruism had no effect on participants' decision-making regarding the effect of unnecessary medical tests. In addition, the vignettes that included appeals to altruism resulted in more negative physician ratings. While some research has found that patient willingness to obtain vaccines and donate blood is motivated at least in part by altruism, there is not much reason for optimism that this approach will be a successful strategy for improving healthcare value, especially in the current social and political climate. And there is a scant research on physician attitudes in the domain tells a similar story. For example, in the earlier study, Merkley et al. Asked physicians to what extent they prescribe antibiotics in community academic areas informed by concerns of creating resistance for other patients. And they found that physicians rated antibiotic resistance lower among 7 determinants of their choices. We clearly have more work to do, educate patients that more care, that is more tests and treatments. Most of the patients think the doctor writes more tablets, he's a good doctor. If he writes more tests, he's taking care of us, he's seeing proper. Not like that. When the clinical skills are very high, no need for test. Okay. Moreover, if you target rational treatment, the drugs will be very less. It means patients should be made aware that the less the treatment, more the care, there will be good result. So that part should be made clear to the public. Many physicians would assert that they were motivated to become doctors in a part of altruism, what is sometimes called as calling. That is, it's just like a God's gift. They are being assigned to do that work. For some, the desire they help may be overwhelmed by day-to-day demands of the work. Interestingly, the concept of pathological altruism, that is, empathy taken to an extreme end. That means the doctor becomes more altruistic and he don't bother about his own physical and mental conditions. He his physical condition becomes declining, and he may encounter mental disorders like that. In fact, over the past few years, there have been alarming reports of high rates of burnout among the practicing clinicians and trainees. As a result, more attention has been focused on the importance of physician well-being. A survey of 2,000 US physicians that examined the association of intrinsic motivators with career and life satisfaction as well as clinical commitment found that physician well-being are focused on extrinsic and intrinsic motivation. Extrinsic are nothing but working hours, income, control over work. Intrinsic is nothing but medicine as a calling, meaningful relationship with patients. Majority said that for them, medical practice was a calling, and the sense of calling was strongly associated with the commitment to the direct patient care. The more they feel that they are altruistic, the more the care will be. Extrinsic motivators such as income and other work-related factors were not strongly associated with the measure of well-being. This study and others will help leaders and policymakers identify the factors that support physician as well as patient and organization well-being. For some physicians, altruism and a sense of calling are the core of their motivation to practice medicine. Others are motivated by more tangible rewards. Whatever the motivation, it is different, that we take the time to reflect on our professional and personal values and strive to align our work with those values. As a physician, we all should inculcate a virtue of altruism for betterment of medical services for the unreached. Once again, I thank all the students for their patience listening and develop the behavior of altruism in your medical career. Thank you.